Good afternoon, everyone. It's time to get our program started. My name is Barry Jantz. I'm the CEO of the Grossmont Healthcare District, and I just want to welcome you on behalf of the Grossmont Healthcare District to our 2020 Healthcare Heroes Awards. Probably in this climate we're in, you are tired of being on Zoom calls and virtual meetings where someone starts the meeting by saying we're in unprecedented times, and we just thank you for joining us this way in unprecedented times. So I'm not even going to say anything about the unprecedented times we're in. Suffice it to say that here we are, virtually, for the first time with our Healthcare Heroes Awards, and we're glad you've joined us. In the past, if you've joined us physically, when we've had events over the last several years, we've tried to have you out by 1:15, and that's with lunch. So without lunch today, although I hope you're having some on your own, wherever you're watching from, we're going to have you out of here by 12:45. That's our plan. But today we hope you're going to be inspired and proud about what's going on in your East County community. Like I said, it's a day to celebrate the spirit of volunteerism. We're in our 14th year. Healthcare Heroes is one of the Grossmont Healthcare District's hallmark events, an annual awards program that honors East Region residents who are extraordinary volunteers in the health field. Today we're honored to tell the stories of several fine local heroes in health. Just a little bit about the Grossmont Healthcare District, though, because I know some of you are guests of winners and you may not be familiar with us. We're a government agency in East San Diego County that started in 1952, at that time, to build and operate Grossmont Hospital. Grossmont Hospital was opened in 1955, so we've got quite a few years under our belts. We moved forward, we were operating a hospital as a government agency, like a water district or a fire district does, but in this case a hospital district, until we got to 1991, and then we were smart enough to enter into a lease with Sharp Grossmont Hospital. So although the public still owns the buildings at Grossmont Hospital, and we do that as a government agency on behalf of all of you, on behalf of the local taxpayers, we've actually entered into an operating lease with Sharp Grossmont Hospital, and Sharp now carries out the patient care at Grossmont Hospital, and we're proud of that partnership. Healthcare Heroes support health in our community every day, in the hospital, in community clinics, in the homes of their neighbors. The list goes on, and that is why we host this program each year and why we started it several years ago, because a lot of times these folks that are spending volunteer hours to benefit all of us in the region don't expect to ever be recognized in any way. These are typically not medical providers who are getting paid for their duties. If they are, this is for the volunteer work they do in addition to what their real jobs are. And many of them don't ever expect they're going to get recognized and don't want to be recognized. So we think it's important, even in this environment of COVID, where we have to do this virtually, that we do it in such a way that we still recognize them. So we're really glad you're going to be able to see that today, be inspired by some of their stories. Some of the organizations today that have nominated these folks, they're on with us as well as several other healthcare providers in the East region. And we hope that whether you've nominated someone or not, you would be inspired by what you see today to think about nominating someone in the future. And when a year from now, or maybe not a year from now, because this program is typically in May, we held off as long as we could, hoping we could do it physically. But next year, sometime, we hope we can do it again in person, and we hope you'll join us at that time. But at this point, without further ado, I'd like to introduce our board president, Randy Lennick. He's part of the 5-member board of directors. They're each elected to 4-year terms. They represent an overall area of 500,000 individuals. And Randy's been the board president now. He's in his 2nd year. He's a retired Marine who has served on our board since 2014. He's also a rancher who lives in Campo. So please join me in some virtual applause for Randy Lennick.
Thank you, Barry. Thank you, Barry. On behalf of my colleagues on the Board of Directors at Grossmont Healthcare District, I do want to welcome you here today. This is always a special event at Grossmont Healthcare District for all of the directors, because it's an opportunity to not only cherish our healthcare heroes, but to think seriously about how really fortunate we are in East San Diego County from a healthcare perspective. We have a state-of-the-art hospital that was built by and for the people of San Diego County, and now since 1991, as Barry indicated, run by a tremendous partner, Sharp Healthcare. We have a lot of tremendous community health providers out there covering a range of healthcare professions, many of whom are represented here today. And we also have a lot of terrific, great doctors and nurses and healthcare professionals. But the glue that brings it all together, that makes it, I think, really special for East San Diego County, are all of our heroes, our volunteers, and that's what we're really here today to honor. We are committed to our district vision to maintain and improve the physical and mental health of more than 500,000 East County residents. You've just heard a bit from Barry about how hard we work toward this vision, and some of you in the audience may already be intimately familiar through partnerships with us in grants, programs, and events. Or some of you may be learning about us for the first time. In any case, thank you for being here, and now I'd like to take a moment to introduce my fellow board colleagues. So let me begin with our board vice president, Virginia Hall, and one of the 2 retired registered nurses on the board. She was elected to the board in November of 2016, finishing first in a field of 6 candidates. Next, it's my pleasure to introduce our current secretary, Bob Ayers. He's a retired banking executive with more than 50 years experience, both in public and private banking and construction and financing and management. He has served on the board since 2010. Serving on the board as the treasurer is a second-generation San Diegan who has lived in East County since 1964. Like Director Virginia Hall, she is a retired registered nurse who has served on our board since 1998. And finally, also serving on the board is the owner of Hart Optical in La Mesa. He has served on our board since 2008, and before that, on the hospital corporate board and the Independent Citizens Bond Oversight Committee, the group of community volunteers who monitored the expenditures for our Prop G bond-funded hospital facility improvements. Again, thank you all very much, and at this point, I'd like to turn the program over to Erica, who is our District Director of Programs and Outreach, who will introduce our healthcare heroes today. She's helped the district to organize this and many other events, and with that, it's yours, Erica.
Thank you, Randy. Well, it's an honor to be here, although it is the first virtual event that I will be speaking to everybody at. For the last 3+ years I've been at the district, it's been really inspiring to be a part of this community. I'm excited to welcome another group of really dedicated individuals in and around the East County region into our Healthcare Heroes family. So thank you. I just want to say before we really get into the meat and potatoes of the program, it's been said that volunteers get paid not because they are worthless, but because they're priceless. And I'm just really grateful to be among a group of community members that not only do that kind of work in their community, but also those that recognize in their peers how important it is to lift up the safety net in hospitals, clinics, schools. You heard from my 2 bosses how many settings these healthcare heroes can be in. But without much further ado, I'm really excited to begin this program with you. Health is a personal topic for all of us. We think that the best way to tell these stories of these individuals is to let them tell you the stories themselves. So although this virtual celebration could never replace the magic of meeting in person, we are pleased to be able to show you this video, hopefully to a much bigger piece of our community than in the years past. So for those of you that are commenting on our live stream, thank you for being here, thank you for watching, and sit back and stay tuned to meet these extraordinary individuals right now.
and just walk in and just take off your mask.
Volunteer with Eric Paredes Save a Life Foundation. This is a foundation that works to provide free heart screenings for teens. There's local volunteers who come in, quite a few, to work to do the EKGs on students to help in the echo room. And so I made Brian and Ben come that day, and I think we were so impressed by the organization, by everything that they did, how professional it was.
And so I volunteer in the echocardiogram room, just controlling the access, bringing people in, getting them ready for the screening. That determines whether they have any other structural abnormalities that are visible on the echo.
It's very humbling in a sense because there's so many people who volunteer, not only with Eric Paredes Save a Life Foundation, but just in East County in general. We're just very grateful for the opportunity to serve Eric Paredes Save a Life Foundation and support the health of teenagers.
I work for East County Transitional Living Center as a driver for them. My job consists of taking people who are going through the program, which consists of homeless moms and dads, people with alcohol and drug problems, to doctors, to DMV, to courts, to anything we can do to help them get their lives back together. East County Transitional Living Center saved my life. I had a drinking problem very badly. I came in here at the age of 53 years old. My life was in ruins. I've kind of wrecked everything around me. My son just got married. He told me that he was gonna have kids someday. He said if I didn't change my life, I would never see my grandchildren. And that right there was the thing that made me stop drinking. To be nominated for this, I got a hold of a lot of my friends and my dad, family, and one of my friends I've had since 6th grade. The first thing he says, there you go, there's proof you work for Jesus. You know, because I'm helping the underprivileged, helping a lot of people don't understand people who have the addictions or living on the streets. And I'm very honored to be picked by this because I enjoy what I do. And hopefully when I share my experiences in life, they can realize that they're not at the end of their ropes, that there is hope. But my life has changed immensely since going through this program. I've got my family back. Everything couldn't be better. It's the best it's ever been. And plus I got 2 grandchildren now, which is the love of my life.
Well, my volunteering goes back a long time. I've always been a socially conscious person. I was asked to be involved with Champions for Health here in San Diego, and I am now a member of that organization, and I do see patients in my office pro bono, and I was fascinated by the people that I would see who were homeless. It was such an amazing group of people. They started like you and I, and then some trauma would occur, and they would then resort to alcohol or drugs to relieve some of that trauma. So with Champions for Health, I was hoping that I could actually see some of these people in my office, which I have been, and help them with their healthcare needs before the downward cycle starts. And so I was honored for this, but I was a little taken aback at the same time because this is just part of me doing this, and I didn't expect to be nominated for such a prestigious award.
I first was exposed to Alzheimer's San Diego. They became my tenant in 2009. And I learned a lot about my tenants when they come to be in our building. I want to understand their work. Little did I know that less than a year later, I was going to need them because my mother was diagnosed with Alzheimer's. And my tenant then became my confidant and my support. And I decided that it was important for me to give back. Well, mainly on the board, you're advising from a perspective, a lot of us are business people, community people, there's attorneys, there's amazing researchers and scientists and doctors. And we work with the staff and leadership to really understand the budgetary restraints that they might be under and advise on how they can achieve in business. My mother was one of those people that was philanthropic and very social and involved in the community, and she was all about be the change you want to see, do for others as you would have them do for you. I'm very humbled and almost kind of embarrassed because I don't consider myself a hero. I just consider myself somebody that recognizes that we have to be involved in our community. We're in the midst of a pandemic, and all of these people are essential workers. Like, Alzheimer's San Diego is probably one of the most essential groups that can be happening right now. So I don't think I'm a hero. I just think I'm somebody that needs to do something or say something and do the best I can with what I have.
I got involved volunteering at Sharp through my cousins. Actually, my cousins are 2 years older than me, and they were already in the program. They told me, why not try it? So I gave it a try. It was in the medical field, which is what I'm also interested in. The volunteer work that I primarily do is help the nurses out whenever they need it. I work on the oncology department on 2 East, and they're normally super busy there. So I try to, be the nurse's right hand, do whatever tasks that they don't have time for, such as, organizing files, answering phone calls, discharging patients, whatever I could do to make their lives easier. The most rewarding experience for me as being a junior volunteer is getting to know a lot of people. Throughout these 3.5 years of volunteering, I've gotten to meet some of my best friends, and I've really built amazing connections and relationships with not only the staff at the oncology department on 2 East, but my fellow junior volunteers. Being nominated as a healthcare hero this year felt amazing. Miss Linda, right when she called me up to her office, and she told me, I was in disbelief. And I really thank Miss Linda for the opportunity, and it just shows that if you put in the hard work, it pays off.
My name is George Bartz. I'm a Sharp Grossmont Hospital volunteer and a Sharp Hospice volunteer. I work at the Thrift Corral 2 days a week, and I currently have one patient and one of the Grossmont Hospital Sharp Hospice homes. In 2012, my wife was dying of cancer. We had Sharp Hospice Care come out and take care of her, and they took care of her until she passed, and they did a wonderful job. And I was taking a neighbor to the hospital one day, and she says, "Look at those guys up at the front of the hospital. Those guys have so much fun. They're called the Blue Angels." And I said, "Oh, what do they do? They're volunteers for Sharp Grossmont Hospital." And I said, "Well, that's what I ought to do." I was humbled because I don't really believe I'm any better than anybody else. I just love doing my job. And because I love doing my job, I volunteer for everything. I've always got my hand up. That's what I want to do. I want to be there if they need me. If you want to see my pins, you can see I have the 2 pins that says I can and I will. Because that's what I want to do. I want to do every job I can do. Because, realistically, I've only got a certain amount of time left in my life, and I'm going to give it all to the people I can.
That was just a great video. The producer of that video and today's actual entire event is Finest City Entertainment. They're based in San Diego, and I just want to give them a huge thanks. Thank you for working with Finest City Entertainment, thank you Finest City Entertainment for working with all of our heroes that you just heard from today to capture these stories for the rest of the community to see. So great job to everybody. You can see this heroes video that was just aired, as well as our full live event later today on our online channels. If you're not able to be with us right now live, we encourage you to post some photos or videos of your own especially if you're a peer or a family member or a friend of one of the heroes. Definitely feel free to use the hashtag Healthcare Heroes or Grossmont Health. And yeah, again, thank you so much for everybody involved in that beautiful production. So without any further ado, I'm going to introduce you to the people that brought us these special stories. So thank you especially to this year's nominators. They're the individuals who took the time to fill out the paperwork, to tell us about their healthcare hero, and to really think through with that energy what it was that inspires them about that work. So over the next few minutes, they're going to join us live one by one from their own living rooms or wherever they are to share a few words about the volunteer that inspires them. So I would first like to invite Hector Paredes with the Eric Paredes Save a Life Foundation to share a few words about the foster family who you just heard from. They're the family that volunteers in the schools. So.
Hi. Well, good afternoon. As you said, my name is Hector Paredes, and I'm the president of the Eric Paredes Save a Life Foundation. We're a nonprofit organization that provides free heart screenings across San Diego County in an effort to prevent sudden cardiac arrest in youth in the name of our son, Eric, who was a healthy Steel Canyon High School sophomore athlete who died suddenly of an undetected heart condition in 2009. Because of what we've learned, sudden cardiac arrest remains the leading cause of death on school campuses and the #1 killer of student athletes. And now I have the great honor and pleasure to introduce to you the Foster family, Brian, Shannon, and their son, Ben. When we learned about the opportunity to nominate one of our volunteers for the Grossmont Healthcare Heroes event, we immediately thought of the Fosters. Brian, Shannon, and Ben have exemplified themselves as volunteers for over 8 years at every one of our youth heart screening events. Their commitment and dedication always starts before the sun comes up on a heart screening day and runs throughout the 10-hour event, which can serve as many as 1,000 youth in one day. The family has spent countless more hours behind the scenes helping the foundation to manage our screening processes. As a direct result of this special family, they've contributed to heart screening more than 34 commitment. Oop, did I get disconnected?
We got disconnected.
Okay. I don't know where I left off here. What part did it disconnect? Do you know, Shannon?
I just know that we've had issues and we're getting disconnected, so you may have been going on and they may have lost us. I don't know.
I think he just said 34,000 kids screened.
Okay. Well, again, I'll repeat probably the most important part of this to all three of you is on behalf of the Eric Paredes Save a Life Foundation and our board. We congratulate you for a tremendous job in this wonderful event and this wonderful award. So, thank you.
Excellent. Thank you so much to Hector and to the Foster family again. Next, I'd like to bring in Harold Brown with the East County Transitional Living Center. He's going to share a few words about their organization's hero, Steve Preston.
Hi, my name is Harold Brown. I'm the CEO of the East County Transitional Living Center. And we have about 450 men, women, and children, homeless, single men and single women, who we've assisted off the streets, and we assist them through our programs and get them back into life. And one of the keys to the success of our program is to have volunteers like Steve Preston. Steve is a wonderful, wonderful man. He's he's given his life to Christ, and he has allowed God to completely transform his life, and he faithfully serves every day as he drives people back and forth to their health appointments and other kinds of appointments that they have in the van that was donated to us by the Grossmont Healthcare District. And so Steve has dedicated his life now to volunteering and to serving others, and is just a great example of an individual who can be just selfless in everything he does. He has a great attitude all the time, as you can see his smile right there. Sometimes, when an individual or a family is in a situation where they're going to an appointment, they're very nervous and they have a lot of anxiety. And Steve is able to minister to them and speak to them as he drives them there, and then assure them that he'll be there to pick them up when their appointment's over. So I just want to congratulate Steve on just being a behind-the-scenes Grossmont healthcare hero.
Thank you very
Thank you,
much.
Steve.
Thank you.
Awesome. Thank you, gentlemen. Thank you for what you do, and thank you for your time. Next, I'd like to invite Eugenia Welch with Alzheimer's San Diego, and she's going to say a few words about her hero and their organization's hero, Susan Guerra.
Good afternoon, everybody. I'm so happy to be here today and to see Susan and just be able to say a few words about her. We are so grateful at Alzheimer's San Diego to have someone like Susan on our board. The old adage is that, for board members, you want them to give of their time, talent, or treasure. And Susan gives us all of those things. You can see she's very humble, and Susan might not think she's a hero, but she's definitely a hero to us. Susan is so involved in our organization, actively engaged at board meetings, an active donor, and really an advocate for us. There have been so many times I personally have called on Susan for advice and guidance in business matters, and she has been accessible and available and so generous with her time and everything she does for us. So I just want to say thank you to Susan. We are so grateful to have you in our corner, and I am so glad that you could be honored here today. And you've been with us since we met you back in 2009, and I hope we are together for many, many years to come. So thank you for being our hero.
You got me. Advocate and donate.
And thank you, ladies, as well, for all of you do and for your time this afternoon. Next, I'd like to invite Linda Van Fulpen, and I'm not sure if her colleague Kay Andalis is with her, but they're both with Sharp Grossmont Hospital, and they're going to share a few words about two heroes today that do different things within and outside of Sharp Grossmont Hospital, Saeeb Abdul Noor and George Bartz.
Emergency Department, Station Alpha.
Hi. Everybody hear us? Hello. I'm Linda Van Fulp, and I'm the Manager of Volunteer Services here at Sharp Grossmont Hospital, and we couldn't be more thrilled to have two of our outstanding volunteers honored this year. Our volunteer program consists of more than 600 individuals who range in age from 14 to 97. They provide over 100,000 hours of service each year to Sharp Grossmont Hospital. But Saeeb's one of our Rockstar Junior volunteers, and I'll have Kay and Dallas, our Supervisor of Volunteer Services, give you some information about Saeeb.
Well, thanks again for having us, and congratulations to all the healthcare heroes. Saeeb, our junior volunteer, has been with us since about 2017 and has over 500 volunteer hours. That's a huge accomplishment for a high schooler when you think that they have AP classes and sports and every other extracurricular activity. He spent all his volunteer hours in 2Es, which is our oncology floor and palliative care floor. And as you heard in the video, he was kind of the right-hand person for the nurses, for the staff, for the clerks. On Friday nights, when every other teenager is starting their weekend, Saeed is in the hospital helping those who need help. He was the Junior Volunteer Auxiliary Board President and was a great leader for all the other high schoolers, junior volunteers in our program. With over 200, almost 250 junior volunteers, there were many students to look to him for his support, for his advice, for just any information on how to be a better volunteer. And outside, he did a lot with his church. He had ASB, great leader, and Saeed, congratulations on graduation. Congratulations on being a healthcare hero. We are very proud of you.
Yay! And now I'll share some information about George Bartz. George started volunteering with us in May of 2015, and he's accumulated over 4,200 volunteer hours as a Blue Angel out in front of our hospital. And then he also, as you saw in the video, volunteers at our thrift store, our off-site thrift store. George's claim to fame there is he knows a ton of customers, which I can attest to since I was there with him on Saturday. And he also was the first volunteer to master our point of sale system. And again, was a rock star and taught me how to use the system on Saturday when I was there. He mentioned his hospice volunteer work during his interview. There he has more than 1,200 hours providing caregiver respite care. And also he participates in We Honor Vets program. He has pinned nearly 200 veterans with an acknowledgement pin and a certificate for their service on behalf of Sharp Hospice Care. George doesn't like to be called sir, so I never call him sir, but our staff at the thrift store call him Mr. George. My special needs nephew calls him Grandpa George, and I call him baby. So congratulations, baby.
Thank you. Thanks a lot.
Okay, thank you to the Sharp Grossmont Hospital team. I think I even saw Jason Broad there, so thank you all. And thank you to Saeed and George. Saeed is actually in class, so he couldn't join us today. I'm sure you could see from the Sharp Grossmont volunteers that heroes come from all walks of life. So last, but most certainly not least, another one of our heroes that couldn't be with us personally, but we still would love to invite Adama Dionysiak with Champions for Health to share a few words about their hero, Dr. Paul Dean.
Hi, everybody. Thank you for having us. Champions for Health has a program called Project Access that provides uninsured people in the Grossmont Healthcare District and throughout San Diego County with access to specialty health care. Dr. Paul Dean is a volunteer dermatologist with us since 2018. So he sees these patients pro bono at his La Mesa office. So he's helping us to fulfill our mission to increase access by graciously seeing patients for consultations, skin cancer screenings, and in-office procedures like biopsies and lesion removals. One of our medical interpreters, because we provide that as well for folks who do not speak English, said this about Dr. Dean on at least one of the occasions that she was there interpreting for a patient. I've had the pleasure of interpreting for Project Access patients during their appointments with Dr. Dean, and his bedside manner and compassion blew me away. Not only does he listen attentively, but he is cognizant of patient-centered care approaches. He goes above and beyond his specialty to ensure that patients have better health outcomes. For example, he made sure that a patient was referred to behavioral health because her dermatological complaints were tied to her emotional and behavioral health. I don't witness that very often, that specialists do that. We also know that besides Project Access patients, he also sees other uninsured patients through another free clinic in the East County. And to make it easy for his staff, he's designated 1 day a week to see these patients. Again, showing his value as a contributing physician as well as a contributing volunteer in San Diego County. He also helped us to get another dermatologist who's also a Mohs surgeon that's part of the practice at Grossmont Dermatology to join us. So we think of him as our hero because he has given his life to something bigger than himself. He's highly motivated to make a difference in the world. He's humble, he's caring and kind, and all he wants to do is improve the life of others. So we are proud to have Dr. Paul Dean be recognized as a 2020 Healthcare Hero for everything that he does for us, the patients of Project Access, and the community at large. Thank you, Dr. Dean.
Thank you, Adama, and thanks once again to all of our nominators and especially our healthcare heroes. So that about wraps up today's program. Just one more thing. Coming to you in the mail to all of the healthcare heroes that we honored today are a special award which represents a token of our appreciation for what you do. Thank you for your volunteer service in the community. So this, along with some other special gifts for our heroes, will be coming in the mail. We'll be in touch with you all to make sure that you get these tokens of our appreciation. So on behalf of the entire East San Diego County community, our Grossmont Healthcare District Board of Directors, staff, leadership, and community members, Sharp Grossmont Hospital partners, and everyone in between, thank you so much for being with us today. Thank you for all you do in our community, and have a great day. We'll see you soon.